Welcome back. This week, Walmart will begin offering lower cost insulin at its pharmacies. So here to discuss this is Tracey D. CEO of the American Diabetes Association. Good morning. Thanks for joining us.
Good morning, Denise. Glad to be here.
Well, this is a big move because insulin costs have been a controversial topic. So tell us, how expensive is regularly priced insulin and what's the annual cost?
Listen, Denise, this is a really big deal. Insulin is not accessible for millions of people living with diabetes. Living with diabetes costs individuals upwards of $9,000 or more. Insulin alone, a vial of insulin could be easily $300, Denise. And when you add that up across the year in usage, that could total over $6,000 or more for a drug that people living with diabetes need to live.
Well, let's talk about the savings here. How deep are the discounts that Walmart is offering and what can folks expect to pay?
This is fantastic. They've come out with rely on Novolog vial as well as the pens. And the vial, you're saving upwards of $100 or more. And on those pens, you're saving upwards of $250 or more. So Denise, this is a really, really big deal. Again, we learned over COVID-19 that 1 in 4 people are rationing their insulin and deciding whether to buy food, pay their rent, or buy this life-saving drug. So this is a big deal.
Well, is the lower price insulin as good as the other insulin options? And are there any pros and cons that people should consider?
Absolutely. This insulin is manufactured by Novo Nordisk, so all good there. And as I always say, you should consult your doctor or your pharmacist and your healthcare professional team as it relates to the insulin. Again, really big deal, Denise. I'm someone who lives with diabetes myself. And again, we are fighting for access to affordable insulin and prescription drugs for people living with diabetes.
Yeah, I know a lot of people with diabetes struggle to manage this financial burden. I guess, do many of them, they skip doses because of it? How much of a difference is this going to make for them?
Listen, this is huge. The one thing we don't want to have happen is people skipping doses and rationing their insulin and prescription drugs. But when you don't have a choice, when it's out of reach from a cost perspective, this is why things like what Walmart is doing is so important. And it's just the first step, Denise. We have to do more. We're proud that we have partnered with Walmart on our Health Equity Now platform. Health Equity Bill of Right number 1 is everyone should have the right to access insulin and drugs affordably. That's the key.
All right, well, I'm sure this comes as a welcome relief for so many people. Tracey D. with the American Diabetes Association, thank you so much for speaking with us this morning.
Thank you, Denise. Have a good day.
You too.